Good afternoon. I'd like to introduce you to the student, Eliseo Ilaraza. I'm Judith Nag. I will be assisting him during this process due to his disability. Now he'll be using the computer to communicate if there's anything he needs to speak or add. He's formulated some questions for you. What is your name? This interview is strictly confidential, however. The limitations are that the Professor, April Moxley, will have access to the interview notes. You have the right to refuse to answer any questions if you like. He states he is just a student but is very experienced, and he's done case management and addiction counseling. Therefore, if there is anything you need, please do not hesitate to let him know. Thank you for your voluntary participation. Your real name will not be used for reasons of confidentiality, so we will call you Aisha, and any other family or close friends you give names will be given a name. There will be no real names given again because of confidentiality reasons. Okay, now some questions for you.
Alright.
How old are you?
I'm 35.
Okay, and what is your nationality?
I'm a Nigerian.
Were you born and raised in Nigeria?
Yes, I was born and raised in Nigeria.
Okay, and do you have any siblings?
Yeah, I have 2 brothers and a sister.
Okay, do they live in Nigeria?
Yes.
Okay, and your parents still live in Nigeria?
Yes, they do.
And when did you come to the U.S.?
About 6 years ago.
Did you come by yourself?
No, I came with my husband.
You came with your husband?
Yes.
Okay. Did you have other family here waiting for you?
My auntie was here when I came, but I wasn't living. I left. I stayed with her for a few months before. When I got pregnant, we had to move because she has her own family too, and she lived in 2 bedrooms. So with a family of 4, I saw my husband, so we had to move when I got pregnant. So I was with her for like a year.
Okay, so you were married. Is your husband Nigerian?
Yes.
Okay, he wants to know what his date of birth is.
My husband's date of birth? Alright, he's 5 years older than me, so.
Okay, is he living with you?
Yes.
And is he working?
You know, our work is not stable, so right now I would say he is working.
Okay. And when he works, what does he do?
He works at a mechanic workshop.
So he's a mechanic?
He's not a mechanic. In my country, he was an engineer, but
engineer?
Yeah, but he just assists a little bit, yeah.
Okay. And are you the parent of any children?
Yes, I have 4 kids.
You have 4 children?
Yes.
Oh, so you're a mother plus a worker plus a immigrant?
Non-immigrant.
No?
I'm a non-immigrant.
Non-immigrant. Okay, what area do you live in?
I live in Brooklyn.
Okay, is it mostly Anglo, African American, or Spanish neighborhood?
Spanish.
Spanish?
Mostly Spanish, yes.
How do you feel on that area? For example, do you feel uncomfortable or comfortable, or is it stressful environment?
So we don't really go out, mostly indoor. So I can say it's comfortable because
It's comfortable.
I don't have any problem.
Okay.
It's not a neat area, you know. What I mean by comfortable is so far there's no crime, but it's not a good area. But there's no crime so far. It's dirty, it's, you know, for low income people like me. So, but for now I can say it's comfortable.
Okay, so he is marital status. When did you get married?
I was married before I came here.
Okay, do you remember the year?
Yes, I was in 2006.
2006? And how old are your children?
My first set of twins, they're 4 years old now, and my other one, I have 2 set of twins. First one, the 4, and the other one now, The 18 months.
18 months.
Yes.
Okay. Boys and girls?
The first one are boys, the second one are girls.
Oh, so you're pretty busy.
Yes, I am.
Okay, and do you work?
Not really. I don't. My last job, I work at it. Right now, I don't work. But my last job, which was 3 months ago, I work at the gas station as a cleaner. For like 2-3 days in a week, 5 hours a day. And I go there when they need me. I don't really have a job because I don't have no insurance. I don't have no papers.
You need papers, U.S. papers? Is that what you mean?
Yes.
Okay.
Oh.
Did you say Walt? I think he's going to ask you this question.
Okay.
You need help with stable job. And can you repeat that? You need help with your papers?
Yeah, I do. I need help and a stable job because right now I don't have anything. For the past 3 months I've not been working. My husband do works, but it's not as safe. Is bringing anything good home because even with the income coming in, we can't even pay the rent. So I would like to help if I could get a job, or for sure. And with the papers, yes, of course, because the reason that I don't have a job right now or a stable job is because of the papers, because I don't have papers. Anywhere you go, they're going to have they're going to be, maybe a green card or something, which I don't have. I came here with a visa, myself and my husband 6 years ago, and it's expired a long time ago.
Okay, so that prevents you from doing other things
yes,
that you
from
want
getting
to do.
health insurance, from getting a good job, even a stable job. Because I've not worked for the last 3 months now. My husband works maybe 3 times a week, 2 times only when they need him, because he has no papers also.
He has no papers, so
yes.
he needs to get papers.
Yes.
Like that. Okay. Are you writing this? you asking this question? Yeah.
You need assistance financially. Clear this, please.
Yes, I do. I need assistance because, with the little income that comes in, we live in the basement, which is very, very little. With 4 children, myself, my husband. We have little kids. I gave birth to my first children there. We've been living there for like 5 years now. Gave birth to my first set of twins there. And the second one, in a basement, which is not conducive for them. But what can we do? We don't have the money to get another apartment. Yes, like a one bed. I mean, at least a 1 bedroom, but we can't. We can't afford it. It's not making much. I'm not working right now, and you can't even pay the rent. Not to talk of, other things.
Can you ask a question about your parents, your mother and father? They're married?
Yeah, they're married. They're still together right now in my country. They live together.
Do you know the year that they got married?
I know, but there's so much information on this.
How old are they now?
How old?
My father is 65. My mother is 60.
Also, they're comparatively young. Your grandparents alive?
No.
No, they're deceased.
Yes.
Your parents and grandparents were Muslim?
Yes, I was Muslim. Yes.
Okay, and you are practicing Muslim?
I am.
Okay, I see you're wearing traditional dress.
Yes. My husband is a Muslim too, and my children, they pray. When we pray, they join us to pray, even though they don't know what to say, but they mimic us, they do whatever we do, and it's fun to me because that's how you learn,
Do you read the Quran?
Yes, we do.
Okay, and you go to mosque?
Yes.
Okay. Is your religion important to you?
Very important, yes.
Very important part of your life? So you feel that spiritually you're connected?
Yes.
Okay. What was the last...
Pause question.
Oh, do you have a question?
Pause question. Getting back to the financial assistance. How are you making it right now?
I can't say we're making it because we have outstanding bills and everything, so everything is not right so far. We're basically not making anything right now. it's hard. Financially, it's hard.
This is important. We will do what we can to get you the help you need right away. Do you have any family here that can help you?
I appreciate if you can do whatever you can to help me. That would be really nice. Yeah, but for me, I have my auntie here though. I have my aunt. She helps sometimes with grocery, to take the kids out with other kids too, She does what she can.
Does she live near you?
Not near me, about taking the train takes me around 45 minutes.
I have to take the train to
I have to get it. Yes. But sometimes she comes to pick my children, maybe for the weekend, in time for the day.
To give you a break.
Yes. She does that.
What do you do for recreation?
Just taking the kids to the park.
Take the kids to the park?
Yes.
Yeah. Do you have a park near the house?
Not near, about 10 minutes walk.
About a 10-minute walk?
Yes.
Okay. Now these are questions about any alcohol, drug use in your history or any sexual or physical abuse?
No.
No.
No. Thank God for that. No.
Is there any history of mental health treatment or therapy?
No.
Do you or your husband or family have any history of diabetes, cancer,
No.
heart disease, asthma, HIV, AIDS, or psychological issues?
No. No.
In regards to HIV, AIDS, first the people blamed that it came from Africa. Now they are saying that Ebola comes from Africa. Can you talk about that?
I really don't know much about Ebola, and I don't believe it came from Africa. I'm not sure about it, so I can't say much about it. I don't know.
Okay. Have you or your husband, well primarily you, because we interviewed you here, ever felt any discrimination because of your race or religion?
No, not at all. Thank God.
And the reason that Eddie has asked about discrimination is because after the 9/11 2001, America views Muslim religion differently, and the videos of kidnapped individuals being beheaded. My understanding is that the Muslim religion is a peaceful religion. You want to share anything in regards to this?
Yeah, it is a peaceful religion, and about the people that beheading, telling human beings like them, I don't think they're doing what God wants. So I can't speak for them. I can only speak for myself. That's not what I believe in Islam. So if that's what they believe, they say Allah will judge each one of us at the day of judgment. So I can speak on their behalf. I don't know why they believe in killing. I don't, I only know what I practice.
Okay.
Yes.
Okay, due to your difficulties with immigration status, we can suggest that you go to a community-based nonprofit agency called Turning Point.
Oh, there's some way that can help with immigration?
Yes, they help with immigration. They also have vocational and educational workshops.
Oh, I like that because I like to go back to school. I like to do something with my life because,
They'll tell you how you can go about that. It's a process.
they're going to pay for the school and that?
I don't know who pays for it, but talking about right now you have no medical insurance,
I don't.
do you?
No.
And neither does your husband.
No, we don't have. My kids have
The kids
though.
have it.
Yes, because when I got pregnant, they give PICA when you get pregnant, and the children will continue to have the insurance. But after like a month or 3, they will call the mother from the insurance. So after 3 months, that's it. But the kids still have insurance.
Okay.
They have Medicaid.
Is there anything else we can be of? Is there any other way we can be of service to you today?
Oh yes, about the house too. If I don't know if we can get a help with the apartment, with the house, because like I said, we live in a basement with a family of 6, and it's a small basement. It's not like it's
Right, it's not conducive to
no, it's not
raising a
conducive.
family.
Yes, and my kids are still young. And I appreciate it if they can help with that too, with housing.
Hold on, Eddie wants to say something.
Okay.
In regards to the medical insurance,
In regards to the medical insurance, did your husband have gotten sick or need any urgent assistance?
Not really. You know, we take preventive measures like monitoring the Tylenol before we get sick. And mostly, we have herbs from our country because my hand travels a lot, so we have the African herbs, which we prevent us from. I only get sick when I'm pregnant, but thank God when you're pregnant you have free insurance, so they do take care of me when I'm sick, when I'm pregnant. No, when no pregnancy sickness, where you got So, except from that, I thank God.
So you sound like you're pretty healthy.
Yeah, I am. Thank God for that. Thank God.
Okay. Is there anything else that we can be of service to you today?
Except from the help I need, the
Right.
housing
I think the
issue.
immigration, getting your papers would be the first
Yes.
thing, because that's what's stopping you from the other things.
Yes.
Your other goals. So
Yes.
it's clear you have goals and ambition, but you're stopped because of what to do about the immigration.
Yes.
Okay.
I have too much on my plate.
You do have a lot.
Yeah, I do.
That's
I do,
true.
and I need help.
Okay.
I would glad, to get some assistance. I will. So, can you give me the address of the point you talk about?
Yeah.
Do you think they can help my husband also? Oh, that would be good.
Yeah.
That would be good.
Yeah, I'll give you their address and phone number.
Is there anybody I have to go to, or when I walk in?
When you walk in, well, you can call them up and see if you can make an appointment with someone.
Okay, I'll do that.
Okay, again, we'd like to thank you for your participation.
You're welcome.
Thank you very much. Okay, Eliseo, would you like to summarize?
Turning Point has been around for a long time, helping people, young people, and many others with their immigration papers. I'm going to say again that the financial assistance and medical insurance is very important. And the housing assistance, they will set up a plan with you prioritizing what is urgent and what can wait.
Okay. That's
Okay.
fine. That's good. I'm glad.
Okay?
That's good.
So I believe that Eliseo just summarized everything that Aisha needs help with financial assistance, advocacy for both her and her husband's immigration status, housing assistance, job search, and Medicaid are also important needs to be met. Suggested to her the Turning Point community-based nonprofit agency. Turning Point can provide her services that she needs.
All right. Thank you very much.
Thank
you
you.
very much.
Thank you.